It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network. This is the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Up first on today's show, we're going to learn about rhinoplasty with plastic surgeon Dr. David Altamira.
I had kind of a bump up here on the bridge, and the end kind of hung down a little bit. It was a little bit big. And I think a couple times in my life, guys had made comments like, oh, our kids would have really big noses.
Well, Holly came in with just the thought that had bothered her for a long time, that her nose just didn't match her face. She's an otherwise very attractive young lady, but she'd always had just a large nose that was out of proportion to the rest of her face.
I mean, overall, Dr. Altamira made the experience so easy and simple. And I think out of all the doctors that I spoke with, he was the one who made me the most at ease with the process. And he said, you know, you can always do more, but let's do something modest for now. And it's just overall really comfortable.
First, we talked to the patient at length. We asked them what they like about their nose and then what they don't like about their nose. There are certain things that, you know, we can change and certain things we don't want to change if they're happy with that. We'll take several photographs from different angles, and then we can project them on the computer screen for the patient, and we can actually morph the images to show the patient what they can possibly look like. And that way we can make sure we're on the same page as far as what the patient wants to look like and what can actually be accomplished in surgery, so that they do have realistic expectations, and we can kind of give them a good idea of what they'll actually will look like after the surgery.
The recovery time was really quick. Dr. Altamira had explained that it would hurt for a little bit. He even gave me painkillers, but I think I took 2 of them. It wasn't as painful nearly as I thought it would be. And I think I had some soreness if I would touch it for maybe a month after, but overall it didn't hurt.
Rhinoplasty is basically changing the shape of the nose. It can be done for a variety of reasons. Usually, a lot of times, just the patient has always felt their nose was too big for their face. They were never happy with their appearance. And so it's basically a great operation that can be used to reshape the person's nose to match their face better.
It was so exciting taking that Band-Aid off for the first time. Like, when you look at yourself in the mirror, you always notice an imperfection that maybe you don't like. And for the first time I looked and thought, oh, my nose is adorable.
As you get older, sometimes you have trouble finding words. So my daughter got all worried, you know, so she'd maybe go to a neurologist. So he does his thing, go back later, he said, it looks like you had a couple small strokes. They're small, they're not gonna bother you. But, he says, you need to go to a cardiologist to check out your heart, just to be on the safe side.
Valvular heart disease encompasses many different entities. The heart has 4 different valves, and Gary Singerman had actually infection and rupture of his mitral valve, which is a very important valve separating the top and bottom chamber of the left side of the heart.
So she sent me to Houston Northwest Hospital, where she had them ordered ultrasound for me. You know, I feel fine. Can I go home now? So my wife and I are sitting there, and she comes in with this film of the ultrasound. She says, could you see the mitral valve there? I said, no, I'm not trained for that. So she points with it to her pen and says, right there, it's hanging down in the ventricle. It's been ruined with the bacteria, and it's not doing anything. And so she says, within a month, you're gonna have a massive heart failure. And I heard my wife gasp, and I got rocked. I wait a minute, I feel fine. She said, I'm checking you into the hospital right now.
Mr. Singerman had mitral valve prolapse, therefore the valve was not closing properly, was redundant and thick, and therefore it was easy for bacteria to stick to that valve and cause infection. And this happened before I met him, and his story is quite interesting, how he came to me. He immediately needed surgery because his valve was infected and ruptured and not working at all. But he's very thankful that he came because we were able to save him.
Obviously, I lived, but the point is I may not have if Dr. Varughese hadn't caught that ruined mitral valve, and so I owe her.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
All the amazing doctors that you've seen on the show today have profile pages with more information, videos. You can even request an appointment. They're all on our website. It's bestdocsnetwork.com. And that includes our next doctor. It's vein specialist, Dr. Peter Morgan.
Clarivein is a new procedure. It's been out maybe for a year or so. It is a procedure that is associated with less pain, both during the procedure and post-procedure. Patients that have venous insufficiency that don't have it corrected are going to get worse. The question is, how fast will it get worse and how bad will it ultimately get? And that's dependent on the individual, how much of their problem is hereditary or genetic and how much is occupational. The typical presenting signs and symptoms, which include pain, swelling, restless legs, enlarged refluxing vessels. If you have the venous insufficiency corrected, the disease progress will completely stop, and if it recurs, it can be easily treated without significant intervention. When you use a laser or radiofrequency ablation to close veins, it's an energy source that produces heat. And so you're essentially burning the veins using radiofrequency or laser. And in order to control that pain, you have to put a tumescent solution, which is a numbing medicine mixed with normal saline, around the vein all the way up the leg. And so that requires several needle sticks, which is uncomfortable, and then that makes the leg kind of full, maybe a little tight, and there's some leakage of the fluid. And with the Clarivein, that tumescence not needed because Clarivein basically has a mechanical agitator, like a skip rope, that spins inside the vein and traumatizes the lining of the vein, and then we inject a sclerosant solution that augments the effect of the skip rope. When you use an energy source, there's always a risk that you could damage a structure that's adjacent to or near to the vein, such as a nerve or maybe even muscle, that sort of thing. And so with Clarivein, since there's no laser, there's no radio frequency, you're not using a heat source, and so it's, I think, significantly safer. All of the procedures are very safe statistically. The number of complications is very minimal, but I think there is some benefit with the Clarivein with respect to complications.
To find a doctor on BestDocsNetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
Here's how to eat more healthy. Eat foods that are red, orange, or yellow. Those tend to be the good fruits and vegetables. Eat more chicken and fish and fewer steaks. Eat higher fiber foods. Bananas are probably the best thing you can eat. They are high in potassium, they are high in fiber, they're high in vitamins, and just generally good for you in every way. There's nothing bad about a banana. Anything that comes in a bag, a can, or a box is going to be bad for you. It tends to have preservatives, and those won't help you digest well, nor are they good for you. Eat a Mediterranean diet. You can Google the Mediterranean diet. They're high in olive oil, high in the white meats, not the red meats, and they tend to emphasize the vegetables and fruits like lentils and beans and peanuts. This is always good for you. So basically, if you're eating what they eat in Athens, you're eating the right kind of stuff.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
I'm studying music education and I'm studying opera. I have voice lessons twice a week. I have choir rehearsals every day. I have opera rehearsals all the time. And so I have to be in tip-top shape. And before this surgery, if I sang for more than 30 minutes, I was done.
So some people wonder what GERD is. What's going on is the esophagus tube goes from the back of the tongue down to the stomach. And at the bottom of the esophagus where it connects the stomach, there's a one-way valve that should let food and juice into your stomach but not let it back up into the esophagus. When it goes back up into the esophagus, it can burn the esophagus and then cause the symptoms like heartburn and coughing, asthma, a lot of symptoms.
Acid reflux all day, every day. I mean, I would eat, acid reflux. I would not eat, acid reflux. Have a drink of water, acid. And so it was one of those things. I would wake up in the morning with a sore throat. It would affect my singing, like I said.
So I've been doing surgery laparoscopically for 22 years for reflux and have excellent results. And what we do is an outpatient procedure. Through very small incisions, we go in there and we reduce the hiatal hernia. So that's basically where there's a little gap in the diaphragm and the stomach's protruding up into the chest. So we pull that down and close that gap in the diaphragm and rebuild that one-way valve. The operation takes less than an hour. People usually go home an hour after surgery. They're usually doing everything within a week. And they're usually getting out of the house in 1 to 2 days after surgery.
Actually, I told Dr. Thomas the results of this have been amazing. The very, very first morning after my surgery, I woke up and I almost started crying, literally, because it was the first time in my entire life that I had woken up without a sore throat.
One of the more common things people tell me after surgery is this is one of the best things they've ever done in their entire life. So this heartburn symptoms kind of is in the background of their daily life, and it may not seem like the worst part of any one day, but when it goes away, their quality of life improves so much and they don't have to live with it. They're kind of ecstatic. It's
been an amazing, amazing improvement in my entire life, and it's something that I'm so, so grateful to have had done.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Now, something as simple as a smile can really brighten your day. Let's check out a smile makeover from oral surgeon, Dr. Paul Metz.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and apply net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
What is advanced lipid testing? Most of my patients say, well, I had my cholesterol checked with my doctor. I say, well, advanced lipid testing is different. It evaluates different parts of the cholesterol, different areas that we can effectively make change. So it's important to do an advanced lipid analysis. There are multiple companies who provide that service. But ask your doctor to look at your lipids in a more advanced way, because there are things on the lipid analysis that can tell us if you have early diabetes, insulin resistance, if you have a high tendency towards clotting, if you're genetically prone towards having a heart attack or not. These are important questions that you need to know. When we're sitting out there in the communities and we have physicians that may or may not know about these things, I think it's important that there are informational shows like this out there that can teach you, the public, to check on your own health. So ask your doctor for advanced lipid therapy. It's an amazing way to take hold of your own health.
The Best Docs Network is all about doctors helping change people's lives. It's educational, informative, and real. Log on to bestdocsnetwork.com.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
the plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that honestly, in my practice, I probably see 10 to 15 times a day. So typically, someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle. And it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The Tenex procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using like a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
To request an appointment with any of the amazing physicians you've seen on our show today, just head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's orthopedic spine surgeon, Dr. Henry Small.
Hip revisions happened for several reasons. One was they just came loose. And they can come loose just because they were never put in correctly, or sometimes they just come loose. And the second reason is infection. About 2.5% of the hips put in nationwide get infected, and once they're infected, they have to come out and you have to start over. Occasionally, I see, like this patient we did recently had been infected for several years. I'd already revised her other hip that was infected, but she's in bad health and she was in a nursing home for many years and had not walked until we revised the first hip. She had not walked in 2 years, and then after revising the first one, she actually got out of bed and was able to ambulate her in the house and for short distances. But the second hip, which had been chronically infected, eventually put her back in the bed and was bedridden. And so we just replaced hers recently. And in this case, her femur was broken in several places. The infection was really bad. I mean, just a very complex 7-hour surgery. But it looks good. 20 years ago, the mortality rate from a hip fracture was around 40% of the people died within the first year. And currently that number is around 10 to 15%. And the difference is fixing it, replacing it more often than trying to fix it, replace it with a new hip, and get out of bed and get back, just get back to activity as soon as we can. I think that hip replacements, for the most part, have just been one of the few miracles of modern science. I mean, you take somebody who's either has arthritis or a broken hip that literally cannot function in life, the pain is so severe, and then do a typical normal hip replacement is an hour surgery. And you can have a hip that's absolutely normal. In fact, 95% of the hips get so good that people forget they had one. And it becomes a normal hip, and they can go on with their life and do everything in the life that they want to do, with extremely few restrictions once they're healed up. I really love what I do, but what I love most is trying to take somebody whose life is really just totally destroyed because of what's wrong with them, because of pain or disability, and trying to get their life back. And that encompasses much more than just the surgery. And that's what I enjoy. It's getting someone's life back.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing. BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
Lethargy, just tired all the time, anxious, couldn't let my mind relax. Paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle. About a week or two before it happened, she would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Those were some really life-changing stories, and that's going to wrap up today's edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really making a difference in people's lives. For more information and to check out hundreds of videos on all the amazing doctors you've seen today, head to our website. It's bestdocsnetwork.com. And if you have a question or comment or a life-changing story of your own, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com. Thank you for watching, and we'll see you next week.